The COVID-19 pandemic revealed just how crucial childcare is to a healthy economy. Remember when essential workers couldn't go to work because their kids were at home, school was remote, but there was no childcare? Well, the federal government acted to deal with that crisis, pouring billions into childcare. But that money's drying up now, and the question is what's next? That's today's story of the day.
Support for Story of the Day comes from Claxton Hepburn Medical Center, dedicated to providing patient care and regional services to the people of St. Lawrence County. claxtonhepburn.org.
Hey, I'm David Sommerstein. It's Thursday, September 28th. This first story mentions suicide. It'll last about 4 minutes. The National Suicide Hotline number is 988. First up, young Americans' mental health has been trending downwards for a while, even before the pandemic. But since COVID, rates of mental health issues like anxiety and depression have skyrocketed among students. For kids ages 10 to 14, suicide is the second leading cause of death. This is Student Mental Health Week, a collaboration among public media outlets across New York State. As a part of our coverage, Anna Williams-Bergen spoke with Glenn Liebman, director of the Mental Health Association in New York State.
So according to the CDC, more than 1/3 of high school students feel persistent sadness or hopelessness. Youth are experiencing a mental health crisis. So could you describe the size and the scope of this problem?
Absolutely. And it's just so incredibly sad. It's difficult to wrap your head around the despair and the anxiety and the depression that young people are feeling. You know, this has always been a sense that it had been increasing pre-COVID, and then COVID happened.
Could you talk some more about the impact the pandemic had on students?
Impact to student mental health is pretty obvious in terms of their inability to have a sort of a linear path to school. One of the biggest concerns around, suicide attempts and suicide completions is isolation. The isolation of not seeing your friends, not seeing anybody, really, you're stuck in your room. I mean, it's just, it leads to all kinds of loneliness, and it leads to depression and anxiety. And it's a natural reflection of the fact that you really don't have linkages and collaborations, and your social network is just completely disturbed.
Can you explain the role of social media in this student mental health crisis?
Social media is a very interesting dichotomy. The positive nature of social media can be utilized to create, again, especially when you're home, isolated in the pandemic, that you have the ability to connect with people in hopefully a very positive way. Of course, we all know the downside of social media as well. It's been well documented over the years, the impact that social media has in terms of young people who really now feel even more isolated because they if they're connecting on social media, they might be being bullied. So it's a really mixed bag.
What can parents and educators do to support students through this? And could you talk a little bit about the resources that are out there to support them?
Yeah, absolutely. So there are different strategies that parents can pay attention to. There are signs and symptoms. Is someone who is usually outgoing, is withdrawn, they're not eating, they seem to be apathetic about life, their grades are going down, they just don't seem to really care very much. So parents should really be looking at the signs. Do not be afraid to ask their loved one or to seek professional help. And around, suicide prevention, there used to be a stigma, like you can't ask someone if they're feeling suicidal, if they feel that way. You can ask them. You absolutely should ask them. That's important. It's documented now. The evidence points out that it's really significant in terms of asking an individual. That's really important.
Glenn Liebman directs the Mental Health Association in New York State. He spoke with Anna Williams-Bergen. If you or someone you know is in crisis, call or text the National Suicide and Crisis Lifeline anytime at 988. The pandemic-era federal child care support is set to expire on September 30th. That has child care providers, experts, and politicians asking what's next. Amy Feiereisel reports.
Over the last 2 years, the U.S. government distributed $24 billion to child care providers in the form of stabilization grants. The money helped providers keep their doors open in the face of unstable enrollment, a workforce shortage, and inflation. It was like a really big Band-Aid.
For the last few years, many providers have used the stabilization dollars to plug the hole.
That's Steve Dweck. He's the CEO of Healthy Kids Programs, which runs over 100 childcare locations in the Northeast. Dweck says many providers are currently losing money, but federal stabilization dollars have helped mask that. With that funding expiring at the end of the month, the fear is this.
Many childcare providers are not going to be able to pay their bills and will not be sustainable.
One study from the Century Foundation, a think tank that does public policy research, estimates that New York State could lose about a third of its 18,000 childcare programs. Senator Kirsten Gillibrand called it the looming childcare cliff.
The Child Care Stabilization Grant Fund is set to expire at the end of September. In New York, that means more than 250,000 children could lose care.
To keep that from happening, Gillibrand recently proposed legislation that would support child care on an annual basis, $16 billion per year for the next 5 years. Gillibrand says access to child care is essential for working families.
It allows them to succeed in their careers and continue contributing to our national economy.
If this legislation passed, it would be a big step closer to the ultimate dream of many advocates, government-funded child care, the same way we fund K-12 schools.
Regardless of the income potential of the families that are enrolled there. That would be the dream, Amy.
That's Alder Rose Blanchard, a childcare provider turned advocate in Saranac Lake. Blanchard thinks $16 billion a year for childcare sounds great. They're not counting on it.
So that money has to come from somewhere. There are a lot of areas of human services that need help and support, right?
And that's the nut of the problem. In the current political climate, Gillibrand's childcare bill is pretty unlikely to pass. Right now, it has 38 Democratic co-sponsors, but no Republicans. And even if it does pick up new sponsors, it wouldn't pass for months, long after the September 30th fiscal cliff. So Steve Dweck, the CEO of Healthy Kids, says they have to assume they're back where they were before the pandemic, on their own.
If there is no increase or there's no public support, how does the industry survive?
Dweck says the childcare industry needs to think big and creatively about its issues, how to widen their applicant pool, how to lean into technology that could help reduce the time providers spend doing mountains of paperwork.
If you're doing it all manually, it's really time-consuming, and there's such a chance that stuff is going to fall through the cracks.
Dweck's company, Healthy Kids, doubled the number of their locations in the last 3 years by centralizing administration.
The administrative departments, HR, finance, and marketing, they do all the back office stuff. So program staff, all they have to do is worry about the kids.
Now that's innovation in a big private company. Most childcare looks like 1 or 2 women in their own homes. But public not-for-profits are trying to pool resources to help those single providers make it without relying on federal money. Alder Rose Blanchard, the provider turned advocate in the Adirondacks, now works for the Child Care Coordinating Council of the North Country. It's partnering with 2 other child care agencies and the Adirondack Foundation to establish a shared services network in 6 North Country counties.
Equipment, materials, purchasing, personnel at a reduced cost to child care providers. The more that participate, the lower the rates could be.
They're calling it the Northeastern Shared Services Alliance and hope to launch sometime this fall. They'll start by coordinating group purchasing for goods and services, like snow plowing and cleaning. Eventually, they want to provide administrative and tech support in the way Healthy Kids does, payroll, HR, even filing for child care assistance.
Every reduction in administrative burden and cost has a substantial impact on the longevity of programs.
Right now, they're negotiating with plow drivers and cleaning companies, trying to get better prices for childcare providers. They hope those local businesses will want to be part of the solution.
It will need an entire community built around it that focuses on childcare as essential and valued.
Of course, Blanchard says federal and state funding would help too. Either way, there's a lot of work ahead. Amy Feiereisel, North Country Public Radio.
We have more news all the time on our website, ncpr.org. Music today by Pencil Dive of Saratoga Springs and Caitlin Scholl of Lake Placid. I'm David Summerstein, North Country Public Radio.